Hi there, it's Mike the PT. I'm the physical therapist with the Limb Plastics Institute, and I'm here to give you your first 2 to 3 weeks of your rehabilitation process following your limb lengthening procedure. We're excited to have you in our office, and we're excited to show you these exercises. So get ready to do them, get ready to adhere to them, and we look forward to being with you on your journey of getting taller. Here is the first exercise, and it's called a short arc quad. As you can see in the picture versus the video, all you have to really do is put a towel or a pillow folded underneath your knees, and you're going to push your knee down and your heel is going to elevate. The second exercise is called a straight leg raise. The most important thing here is to keep your knee straight, and you're going to lift to the height of the opposite bent knee. 3 sets of 10 repetitions. The next exercise is the supine hip abduction with a band. A TheraLoop or a TheraBand would be fine with this one. And opposite to that exercise is the supine hip adduction. And so all you're going to do here is take a folded pillow in between your knees and squeeze. The last exercise is a bridging exercise. And one thing to remember is that all these exercises can be done on your bed, not necessarily on the floor. Hey guys, Mike Russell here, your physical therapist, supporting you along your journey in the limb lengthening process. As the physical therapist treating a majority of the limb lengthening folks for Dr. Debbie Parshad at the Limb Plastics Institute, I use some equipment frequently, and this type of equipment is going to be integral for you at your home, at your Airbnb, or the hotel, wherever you're staying. As well as when you return home if you're visiting Las Vegas just for the surgical procedure. A couple things that are very, very important to you, and I'll provide you with links and a little more detailed instruction on how to use them, but just to give you an idea of the things that you're going to be using. One thing that I do like to use is a massage roller. This is used to roll over the muscles, specifically the quad muscles, since they are the ones that get most tense, tight, and sore. So this is something really, really beneficial for patients to use. I use this with almost everybody. The other thing is a stretching strap. Now from the hospital, you're going to get a blue, looks like a leash with a loop at the end of it. This is a little bit easier to use as you progress on in your rehabilitation. It's just a strap. It has several loops on it. We do several stretching activities with this. Very, very beneficial for you. TheraBands, that's the brand name. So these are just Pilates bands or yoga bands. I've heard them being referred to. Stretchy bands that we use to start into the strengthening process. We're not going to do anything heavy with a heavy overload. Most things are body weight or with a slight resistance that the bands do provide. You like to get 3 different colors or resistances: light, medium, and heavy. The other thing I use are cuff weights. These are 5 pounds, and they are removable weights from inside these pockets right here. It allows me to adjust the weight that you're using, starting you at about 1.5 pounds, moving you up, and we get to about a 5-pound weight on the ankle that we do for a variety of different exercises. And I'm going to demonstrate a lot of those exercises for you with a couple of patients that have agreed to be filmed and videotaped. Remember, this is a process. You don't wake up from surgery and the procedure is done. You wake up from this surgery and you have about 4 months to go, especially with what we're doing with the Precise 2.2 nail, okay? So you need to understand you're going to be using a walker for the 4-month duration that it takes to lengthen and then consolidate your bone. Remember, if you have any questions about that, talk to Dr. Debbie Parshad about that. However, what we're trying to let you know is you can be mobile, you can drive, and you can function fairly well within your daily life. You just have to do it with a walker or an assist device. And the number one assist device that I've been teaching patients to use is not the Axillary crutches are the crutches that come underneath your armpits, but they're forearm crutches. And I'll show you how to use those too.